Welcome into the Family Pet Podcast, the podcast for curious pet parents, where we believe the more you know about pet healthcare, the better pet parent you can be. I'm your host, Michael Shirley, joined as always by Steven. Welcome in, brother.
Hi, Michael. We've set it up differently now that we're looking directly across at each other.
This is awkward, and we're putting our guest on the hot seat here.
I love it.
Do you like the radio voices here? You just kicked it on.
Yeah, you guys have it going on.
Just went straight to it. Jump in.
It's great.
Hey, we are going straight to it today. For those of you listening at home, we are joined by Dr. Ben Bergstrom. That you can't see him, but he's a local veterinarian. That is, we're going to talk more about what his specialty is here in just a minute. But for those of you watching on the YouTube, welcome in. You all, if you're listening and you want to see what do these guys look like?
You don't want to see that.
Well, if you want to check it out and see what we look like, go to YouTube and just search for the Family Pet Podcast, and it'll pull up. And the reason I said if you want to see,
and you said it like see,
nobody picked up the first time. I was kind of leading into that. We're talking with Dr. Ben Bergstrom, who's from the iVets in Nashville, Tennessee, and he is a board-certified ophthalmologist.
That's correct.
Not an optometrist.
That's correct. We do medicine and surgery for eyes as opposed to fitting glasses for dogs, cats, and everything else.
Are there veterinary optometrists out there?
Not currently.
Okay,
but it's probably something that I see in the relatively near future.
I can see.
You see,
like
when the Belgian Malinois jump out of the planes with the special forces, they all have their goggles.
You've been
Yeah, the
watching
Rex
John
specs.
Wick. What are they called?
Rex specs.
Rex
specs.
So do you remember
Yeah.
sports back in the day when you had the big giant goggles? Those
Yeah.
were the Rex specs. Now these are REX.
Nice.
Nice.
Airbud.
Yes.
Yes.
So
Well,
there are glasses for dogs.
I
but
see people
maybe
riding their
not.
motorcycles with their dogs, and
That's right. You got to protect them.
Yeah. So we'll talk a little bit about eye protection. So for our listeners out there that maybe are familiar with the human medicine terms ophthalmologist and optometrist, can you tell us, are those the same when it comes to veterinary medicine? And what is the difference between those two?
Yeah, good question. So ophthalmology, generally speaking, is the practice of medicine and surgery for the eye, whereas generally, optometry is more the study of vision. So not that we aren't interested in vision in ophthalmology. We, of course, our goal is to preserve, restore, save vision, but the ways in which that we're going about it are a little bit different. You know, we're not fitting contact lenses for vision. We use contact lenses, and we're not fitting glasses and things of that nature. So.
Well, I think about it, an optometrist, you cover your eye and you read the chart.
That's right.
Maverick's really smart, but I don't know that he could read out any letters to me to let me know if his eyesight was blurry or.
All right. So enough about the optometrist. We're going to focus on ophthalmology today.
Perfect.
Because you are a boarded ophthalmologist. Now, many of if we have a new listener, maybe this is their first episode of the Family Pet Podcast, they may not be familiar with the term boarded veterinarian. What does that mean?
So for any veterinarian, as you guys well know, it requires 4 years, at least 4 years of undergraduate training at a university, and then an additional 4 years at a veterinary school. If you decide you want to go on and specialize in a specific facet of veterinary medicine, it requires additional training afterwards. So oftentimes it's a rotating internship, which is you leave vet school and you go and you work in medicine and surgery and ER. Then thereafter you apply to whichever specialty for a residency, similar to what's done in the medical field, the human medical field. So for ophthalmology specifically, my training, I went to veterinary school at the University of Illinois. I then had my rotating internship at the University of Georgia in Athens. And then my residency was at Purdue University, and that was 3 years after the 4-year vet school and 1-year internship. And then I landed in Nashville thereafter.
What was it about eyes that really interests you?
Yeah, I went through most of vet school thinking that I wanted to be an equine surgeon.
Okay.
I really was drawn to equine medicine and surgery, and I didn't grow up with horses like a lot of equine vets out there do. And so I reached my final year of vet school really loving ophthalmology each time I had been through in class, and realized that ophthalmology allowed me to look at horse eyes, as well as dogs and cats, as well as elephants. And a couple of weeks ago, had the opportunity to work at the Nashville Zoo on a clouded leopard cub, which
that's
was
cool.
amazing. So ophthalmology just gives us the opportunity to work with every species, and it's a lot of surgery, a lot of medicine. So it's a really no day is the same.
All right, you just listed a lot of different species: an elephant, clouded leopard, horses, dogs, cats.
Yep,
But you're an eye doctor.
that's right.
So is the eye the same across all the species? I mean, the function obviously to help see, but I know that like reptiles or some animal has like a kaleidoscope of eyes. Talk through that. I don't understand.
Is that a spider maybe? Okay.
I don't know. There's right. Maybe it is a spider. I don't know.
So the basics of the eye across all species, humans included, are relatively similar. Where the objective is to have vision, interpret vision, send it to the brain. But when you dive deep into the specifics of it, the thickness of the cornea, the curvature of the cornea, the depth of the anterior chamber, which is the fluid-filled part of the front of the eye, the iris. What muscle is responsible for controlling the iris? Is it circular? Is it slit-shaped like a cat? Birds, for example, have bones in their sclera, the white part of the eye. So when you dive deep into the individual
fun
species,
fact for you.
yeah. So when you dive deep into the individual species, there are species differences, but as a broad topic, the eye has the same goal across the board.
To see predators. No.
Yeah, right. Well, and it's actually, I mean, it's
prey,
amazing when you look at things like rabbits, for instance, the positioning of their optic nerve, the nerve that travels from the eye to the brain. It's positioned in a location that, because their eyes are positioned in a location that, they're prey animals. So they need to be able to look out and up, because that tends to be where predators come from.
Danger
So,
from the sky with the big bird.
That's right.
Or perhaps a Belgian Malinois jumping out of a plane with glasses.
That's right. Rex
With
vets.
goggles.
Yeah.
Well, so for your practice, what would you say is the most common species that you treat?
Far and away dogs.
Okay.
I would say probably about 75 to 80% of our practice is dogs. And then cats would follow thereafter. And then we do see a fair number of rabbits. We do see reptiles. We see birds. I had a snow goose in a couple of weeks ago. I had a woodpecker in a couple of months ago. Again, never a dull moment. You never know what's going to show up.
Were
on the
those
schedule.
somebody's pets, or was that rehab, like wildlife rehabilitation?
Yeah, so we do a lot with wildlife rehab. And then, I'd mentioned we'll occasionally get to do things at the zoo. I work with the elephant sanctuary in Hohenwald, so I've been over and seen elephants over there, which, just an amazing facility. So, yeah.
There's a big cat sanctuary somewhere in Tennessee too. You ever?
I haven't been to the big cat sanctuary. When I was in vet school, we went and did some dentals at a big cat sanctuary in Indiana.
That's Dr. Shirley did the same. She has a picture of doing a dental cleaning on a tiger, and it was at the sanctuary. And she talked about like walking in, just hearing all the roars through the woods. It was really,
eerie.
she goes, it's really creepy. So
And it also, I vividly remember the smell of the sanctuary, because they predominantly live on a raw diet, and you can smell that.
oh
in there,
man,
so.
yeah. Your eyes, your eyes were working.
Yeah, that's right. That's
they
right.
were real big that day. Oh
right.
man.
If you're seeing mostly dogs and cats, which are mostly what our listeners are owning, if they are thinking about their pet's eyes, why do the pets come to you? What are the conditions that you're seeing? Are they acute, meaning a sudden injury, or are they more of a chronic issue?
Yeah, it's funny. I feel like we're a very busy service. So short answer is, I feel like we see a lot of acute change. So a dog has developed a corneal ulcer, an injury to the surface of the eye, or they've been born with abnormal eyelids or something along those lines. And so it's a relatively urgent matter to come and see us initially. Those urgent matters oftentimes turn into chronic conditions. So if an animal's been squinting, the eye's red, maybe they have glaucoma, high pressure inside of the eye. And so we get them started on medications, and then it's a management thing moving forward. But a lot of people come in to see us and they say, I had no idea that veterinary ophthalmologists existed. And I think that's just because, unless it's not a part of the normal routine, and unless something suddenly happens, they don't really know that we're there. So it's our goal to try to get the word out.
Seeing a lot of new dog breed crosses. People are, these little, what they call designer breeds or boutique breeds or whatever. But I also think about pugs and bulldogs. Are there certain breeds that are more predisposed to eye issues than others?
There are, absolutely. There are breeds that are predisposed to certain inherited conditions that aren't the breeds that you would, for instance, the golden retriever. The golden retriever is an amazing, very popular breed, and as it's been bred, some of the ideal traits that they're bred for have also kind of unearthed some of the less ideal traits. And so we'll see a lot of golden retrievers for various things, but the breeds that you would think that we'd see a lot of, the pugs, the Shih Tzus, the Boston Terriers, the Bulldogs, we do see a lot of those. And then a lot of it comes down to the prominence of the eyes. So their eyes are just more exposed. They're larger. The Bulldogs, they've got the nasal folds they have a tendency to carry more bacteria and things of that nature. So we see a lot of the breeds that you would expect and a lot of the breeds that you wouldn't necessarily expect.
So if people have some of those breeds like bulldogs, pugs, Boston Terriers, should they go ahead and find an ophthalmologist at the beginning of their career, or at the beginning of their journey through having a pet in their family, or do they just wait until there's an issue?
That's a great question. I would say it would never be a bad idea to come and see us straight away. We actually, as a side note, as dogs are bred, we perform breeding exams, OFA exams, similar to what are done for hips and things like that for dogs. And the intent with those exams is for puppies and the parents of puppies to make sure that they don't have some of these bad inherited diseases. So if you have just gotten your dog from a breeder and you want to know that they have a clean bill of health, bring them in to see us. But I think more importantly than that is when they are seen for their annual visits at their primary veterinarian, checking tear production, measuring intraocular pressures, making sure that their eyes are normal, because the subtle changes, dogs and cats don't let us know that things are wrong with their eyes until they've gone really, really bad often. And so if you can catch that the intraocular pressure is trending upward, then that would be a good time to come and see us.
Stephen, that's just the way my brain works. But I'm sitting here hearing you talk about making sure that we're doing those pressure tests. We need to make sure that I honestly don't know the answer is if we have the tool to do the pressure test.
Well, and that's what I was actually going to go back to is my family had a little Shih Tzu, and it was during COVID. So 3.5, 4 years ago, she was squinting, and they did a couple of tests. And I understand that these are the most common tests. Is a Schirmer, something like a Schirmer tear test.
That's right.
And a ocular pressure test. Can you walk through what
make
those
sure
two
you pronounce those right?
Well,
and
right.
tell us
I
what
don't
they
have
were.
a clue. I just saw it on my bill. And just what those are and what you're doing.
Yeah,
how you do them.
Absolutely. So we have 3 baseline tests, and the tests that we offer are tests that can be done at any practice. It's not special to us. Those are measuring tear production with the Schirmer tear test. So for that test, we have a piece of paper that has essentially a ruler on it. You set that piece of paper inside of the eyelid. It contacts the surface of the eye. If you can imagine what it feels like to stick paper on the eye, it causes you to tear. So what better way to measure tear production than to cause irritation? So we measure what the tears are. If they reach the 15 to 25 millimeters per minute, which is our baseline, that's considered normal. Your dog does not have dry eye. Next is the intraocular pressure. So we are measuring the pressures inside of the eyes. That is done In people, they'll usually think about that puff of air that you get when you go to visit the optometrist or ophthalmologist. We have slightly different instrumentation. I imagine you guys, the instruments that you guys have are a little bit different. But the intraocular pressure, so normal for a dog is anywhere from 15 to 25 is what the textbook tells you. It can be a little bit less, but as I was mentioning before, if they're being seen annually and you're noticing annually that the pressures are continually starting to go up, that's a really good thing for us to continue to watch, because dogs don't let us know they're bad until they're really high. And then lastly, it's the corneal fluorescein stain. So if a dog they go into the vet and they're squinting and they put that highlighter on their eye, they're looking for scratches, abrasions on the surface of the eye.
Now, in particular, the ocular test, because that was one of the things that our team was concerned about.
The interocular pressure.
Right.
test,
And
okay.
that's glaucoma.
Right. So intraocular pressure, so if you can kind of imagine the way I always describe it to owners, glaucoma as a disease process. So the eye is essentially like a closed bathtub. There's a faucet and there is a drain. In order for the eye to maintain shape, its normal shape, the eye has to produce fluid at a certain rate, and it has to leave the eye at a certain rate. Glaucoma develops when it keeps producing fluid, but it stops leaving at the appropriate rate. The pressure starts to go up. So that's when we start to see a red eye, a cloudy eye, a big eye. Maybe their vision is decreased. In the earliest stages, we'll start to see the pupils a little bit dilated. But most people won't pick up on that until it becomes very advanced. And that's when it prompts them to bring them in to see you or bring them in to see us, and we measure high pressures. And
is that something? So that's something that it sounds like can develop very, very slowly. And you said year over year testing.
it can. So if there are certain breeds that are predisposed to developing glaucoma. And if you have one of those breeds, or just because of the way dogs have been bred and certain traits are being bred into certain breeds, measuring the pressures and seeing if they're trending upward is a good way to go about catching it.
So I hear maybe some of our listeners are like, well, I wonder if my breed is one. I sometimes cringe when people go, well, Google it. But in the lack of another resource or place to go, that's probably what they're going to do. Do you have resources on your website where people can look to see if their dog breed or is predisposed to eye conditions?
Yeah, so I don't have the specifics for dog breeds, but I have the specifics for the disease processes. So if you visit our website, theivets.com, we have a list of handouts for the various disease processes that dogs and cats specifically can develop. And within that, I do talk about the various breeds that can be impacted by it. And so if you're a pet parent and you have one of these breeds, then it would be great, to reach out to you guys and just ask when you're in for your annual visit, hey, I have a beagle, I have a basset hound, and I know they're predisposed to developing glaucoma. Would you mind measuring their pressures?
We're going to be like, oh my gosh, you're so awesome as a pet parent. Yes, we'll do that.
Well, I'm just kind of thinking through, is there an age when this
Should they
senior
start at
pets
their-
has
yeah.
become a focus? Because we had to help Gracie pass, and then Maverick, my other dog, is 5 years old. He's not senior, but he's starting to enter that phase. And so I'm like, at his annual in April, he has to fully sedate. He doesn't like needles. Well, if we're fully sedated, let's just go ahead and do some of these tests just to get the baseline. Because I do his blood work every year.
Yeah. Why
Then-
not check his pressures?
And get a baseline.
You want
just
him to
gonna
be able
keep-
to see you. So do you recommend for to start at their first visits?
Absolutely.
okay.
Yeah,
Just have it as
absolutely.
another resource.
Because there are also breeds out there, the husky, for instance, which we can see develop congenital glaucoma. So they're born with higher pressures. Young dog eyes are much more forgiving to high pressures than older dog eyes. The eyes are a little more elastic, and so they may not show us that their pressure's high until it gets really high and the eye suddenly looks big one day. So I wouldn't necessarily say, unless there is something that prompts you to check pressure at the 3-month visit. But at the 1-year visit, absolutely, start measuring pressures, start measuring tear production. And it's just a great thing to track as the dogs age. And then if you need us in the meantime, reach out to us, send them, send the pet to come and see us. And we're happy to help.
When it comes to eye issues, does early detection decrease the amount of money that a pet parent may have to spend, or does it also increase the outcome? Like does it increase positive outcomes? So, like, just talk about early detection.
Great question. I don't. It's a tough thing to answer, because I think in a lot of instances, the maintenance for these things is not common. There are practices out there that regularly measure intraocular pressures and those that measure tear production, but a lot of times they're not done if the eye looks normal. And so we are faced with dogs coming to see us that have suddenly lost vision. The eye's very, very painful. The pressure's really high, and we do everything that we can medically to try to bring the pressure down. And maybe it doesn't go down. And it doesn't mean that the dog developed it the day before and suddenly they can't see. It's probably been going on for months and months and months. So to answer your question, early detection is very important, because if we can get a hold of it, get them started on medications, oftentimes we can preserve vision, make sure that they're comfortable longer.
I'm just starting to calculate, because one of the other things is we're going to do is he's fully sedated with Maverick. We're just going to throw him on the x-ray table and get some. He's never had x-rays, so
Ultrasound, yeah, just might as well do it all, right?
let's get it all
Well,
done.
I think preventive care is just such an important thing, and that's why family pet health, for instance, is such an important place. Regular routine visits, annual visits at the very least, is so important for our pets. And for you guys to be able to do some of these routine measurements is just so much better for pets long term.
Yeah, so, and that's why I was asking about the cost, because obviously if we're running tests here, there's a cost associated with it. We talked about it on a previous episode with preventative care, is that, you're like, well, he looks fine, so I don't want to do the blood work.
Yeah.
But because it's expensive, and then we just come back and say, oh, well, everything's normal. Well, sometimes pet parents may feel like, well, I just wasted that money then.
Mm-hmm.
But what we talked about in that episode was that it
Normal's
gives us
good.
our baseline, so that the next time when we come in, it might be within normal limits, but it's really gone up from the first time that we tested. So we're like, let's wait. Let's do this in 6 months instead of a year from now.
Yeah.
So we may catch things early.
Yeah, and I guess I didn't answer specifically as far as the cost benefit of early detection. When we see these animals acutely because they're painful or they're blind, or something bad has happened and surgery is recommended. Surgery is, of course, much more costly than intraocular pressure measurement, for instance. So does it mean that they won't ultimately require surgery in the future? No, not necessarily, but you may be able to buy time before they get to that point.
And by time with vision, like if you had to choose one sense to lose, that question, the eyesight's my last one.
That's
like,
right.
I want to keep that one till the very end. You can have my sense of smell,
Or
I'm
my
fine with
taste.
that.
You
Or
can
my
take my
taste.
taste.
I'm totally fine with. Although I will miss Dr. Shirley's meatloaf. It is the best. But I want to be able to see, and I can see that with our pets too. We want to make sure that they can see us and we can see them. And caring for a completely blind pet, I would say, is a challenge. I know that there are a lot of people that have it, but
It's really amazing to me. Do I think animals can do well blind? Absolutely, much better than you or I would. They use their nose, they use their ears, they get around okay. But when you can see, we offer cataract surgery. We offer other procedures that help to restore vision. When you can see an animal that has gone blind, even if they're 14, 15, 16 years old, and you get them back to normal or near normal vision, it's amazing what it does to their quality of life. The owners that come in, it gives me chills talking about it, honestly. The owners that come back in after they've recovered from these surgeries, and they're like, I thought they were just getting old. They were sleeping. They were doing. Now they can see again, and they're running around, and it's remarkable.
That's
so,
awesome.
It's my job to work with staff like you, veterinarians like you, that we can all work together to make sure that we can preserve vision, and we can do these things to extend. Cats are living so much longer these days. So let's make sure the quality of life is good for those last years.
Well, I really appreciate you taking the time to come and join us today to talk about it. You're doing great work. I know that even from this episode, I've learned a lot.
Absolutely.
I didn't really realize that your eyes like a faucet and a drain. So where does it drain?
Where does it coming
go?
in and where's it leaving?
Let's rewind and go back to that.
All right, so those that are listening and not watching, this is not as helpful. But for you guys that are sitting here,
If you're listening right now, stop, mark where this is, and go find us on
That's
YouTube
right.
so you can watch it.
subscribe to the YouTube
That's
channel.
right.
That's right. So the eye, it has the iris, the colored part of the eye, the pupil. Fluid is produced directly behind the pupil, 360 degrees around the eye by this little faucet for all intents and purposes. Fluid flows through the pupil to the front of the eye, and then also 360 degrees around the eye. There is a drain, kind of looks like a meshwork. Fluid leaves through that meshwork and then goes into the body elsewhere. So with glaucoma, primary glaucoma, for instance, which is a developmental anomaly. Dogs are born with an abnormal drain. Over time, the drain continues to shrink and become more and more abnormal. There are other types of glaucoma, secondary glaucoma, where there's a physical obstruction. It's like a hair in the drain, but it's a tumor, it's blood, it's the lens has shifted in front of the eye, and that causes the pressure to go up also.
I will never, brush my teeth and spit down the drain without thinking about eyeballs now.
Good. Good. Glad to know it.
Wow. Okay.
Yeah, that's
I went in a different direction.
Well, I just
Brush my teeth, think about my eyes.
That's right. Think about your eyes. Well, they're important. So, well, Dr. Bergstrom, thanks again for coming today.
Thank you.
Before we let you go, it's time in our show that we ask our guests to bring a fun fact to the audience. You've already shared some, like that the birds have bones in the white part of their eye. That was a free fun fact. But this is another one that you're going to share with our listeners to help them win trivia night at the local bar, or at least impress their friends and family
Very important.
at family dinner, which is more important, I think. Yes. So, Dr. Bergstrom, what is your fun fact for our curious pet parents today?
Fun fact for curious pet parents today. Let's see. As it relates to trivia also.
Yes.
I think we get a lot of questions about what do dogs see, and there are some that think that dogs see gray. There are some that think dogs have blurry vision. Their vision is not as sharp as ours, but they do have, and they don't have the spectrum of color that we see, but they do see color, and they also have the ability, because of a structure in the back of their eye called the tapetum lucidum, they're able to see better at night when light enters the eye, and it hits this structure, the tapetum lucidum. They're able to actually utilize that light twice, whereas us, light comes in, goes straight to the brain. So they can maximize the what they can see in dark conditions. So I guess to shorten that up, because that was a really long answer, the trivia question is, what allows dogs to see at night? And it's called the tapetum lucidum. Let's call it that. Let's say that.
It sounds like a Harry Potter spell.
Right.
Night vision.
Night vision.
It's the night
Tapetum
vision.
lucidum.
Yeah, there you go.
That's right. Well, we hope that we've shed a little light on eyes today for you curious pet parents today on the Family Pet Podcast. If you enjoyed this episode, share it with a friend. Be sure to like and follow wherever you listen to your podcast, or go on YouTube and like us there. Until next time, stay curious.